Hello everyone, and welcome to the fourth Talking Tuesday video series where we will review frequently asked questions and topics specific to health links and coordinated care plans. In this session, we'll be talking about maximizing collaboration and the care team approach through the use of a care conference. So let's start with discussing the benefits of a care conference. So what are the benefits? A care conference provides the opportunity to communicate and collaborate between the client and the care team members, identify the most appropriate integrated care lead, establish the roles and responsibilities of the care team members, create new goals, resolve conflicts, strategize solutions, and adjust the current service plans. The benefits to the client include visual representation of their supports. So oftentimes it is much more meaningful to the client when they can actually see their supports rather than just to know who they are and that they exist somewhere. Another benefit is the opportunity to be an active participant and advocate for their health care. So they're really able to make decisions on the spot with their entire care team present. The benefits to the care team members include being able to speak to the services and supports they can provide to help the client achieve their goals, utilizing the strengths of the other care team members, so really that expertise that they may have from other careers prior to and their existing expertise within different fields, increasing accountability, improving transitions, and making the interaction more personable. The goal of the care conference is to provide holistic, coordinated, and integrated services across providers and to reduce barriers and duplication of services. The care conference is really about wrapping care around the client. So when you have everyone present in the same room, on the same call, or on the same video screen, everyone is aware of what is going on in a client's case, and the communication is then most effective at that point. The next frequently asked question is, how do I complete a care conference? So there are 3 stages for the care conference, and we'll be going through each of those in greater detail in the next few slides to follow. But those include the pre-conference, so inviting providers and participants and setting up the pre-logistical items prior to the meeting. Next is the actual conference, which includes reviewing the coordinated care plan, looking at the client's goals, establishing roles and responsibilities, and lastly is the post-conference stage. So this ensures proper follow-up is taking place, communicating any updates that have taken place, and reviewing the client's goals and progress throughout their journey. So going back to the pre-conference, during this stage, the client has provided consent to the initiation of the coordinated care plan, and they have agreed to sharing personal health information with their care team setting. It is important that the integrated care lead set a time and place for the care conference and they invite the care team to attend. Provide everyone with some context and/or the coordinated care plan ahead of time so that they're able to review it and understand the client's situation prior to meeting with them. If the client or substitute decision maker does not want to attend, the integrated care lead is then responsible for articulating the client's goals during the care conference and articulating back to the client for the outcomes of the care conference. Prepare the client, so really review the purpose of the care conference and in particular the client's goals. Encourage them to be an active participant in creating the coordinated care plan. Have the coordinated care plan initiation update form, consent form, and the coordinated care plan accessible during the care conference to make updates and edits as necessary. Remember that care conferences may be face-to-face, by teleconference, using OTN, and they're usually held at routine intervals or during significant change. So we'll be talking about that a little bit in the conference section. So moving on, the next phase is the actual care conference itself. The current integrated care lead will welcome the participants and introduce themselves and ask them each to describe their role. So really, again, this explains everyone's roles and responsibilities within the care team and how they're supposed to help the client. Explain the purpose of the care conference and describe the process that is being followed. So each care conference is slightly different, but do what makes most sense and what's most appropriate and beneficial for the client. You can assign a note taker if you wish, or take notes yourself. You'll want to discuss the client's overall medical history, any current challenges that may exist, any goals that they may have, And invite further comments not only from the client, but also from the family members, as they may have different perspectives as well. Once the client's goals have been established, you'll want to invite the participants to share their perspectives on how they can help support the client. And of course, that's given their expertise and knowledge set. And the goal, of course, is in achieving some of these goals, and then link the goals with the available resources that may exist. So these may include community resources, social supports that may be included within that, hospital resources, home and community care, and other ones as well. A timeline should be determined to promote accountability and really working towards those clients' goals. You want to document points of agreement and disagreement, and then perhaps come back to them at a future date as well. Identify the most appropriate integrated care lead. So this may be the same as the already existing one, as it really does pertain to the client's goals, the services that are provided, and builds the relationship with the client. It also provides the client with the care lead's contact information, as they will be the single point of contact if any concerns do arise or if the client themselves just has questions. If the coordinated care plan is on HPG or Health Partner Gateway, the initiation and update form, as well as the consent form, needs to be updated and faxed to the LHIN. You want to document in the coordinated care plan under the appropriate headings. Ensure that the completed CCP is shared amongst the care team members as well as the client. Documentation should be completed in clear and simple language, and that's really just to ensure the client and everyone else can easily understand the information being shared. You'll want to avoid acronyms or healthcare-specific terminology whenever possible, and although we use the term CCP and Coordinated Care Plan or ICL and Integrated Care Lead interchangeably, if you do the same with the client, really just ensure that they understand that this is the same thing, because really we want to make sure that all information is as clear as possible and less confusing for the client. The last phase is the post-conference. The care lead will circulate the updated coordinated care plan to the client and each care team member. The integrated care lead will meet with the client to review the plan and action items and will continue to monitor and update the coordinated care plan with members of the care team as needed. This process can be repeated as necessary, especially when there have been a change to the client's health status, the client's goals have changed, or to discuss progress on the goal section, when there are problems that need to be resolved, barriers that have been identified that hinder the client from succeeding, or any other sort of changes along those lines. Every care team member is encouraged to document in the client's record as per professional documentation standards. So again, that may vary from organization to organization. The next frequently asked question is, when should a care conference be conducted? So a care conference can be conducted at various points throughout the client's journey, and some of these points may include in the beginning phases of creating a care plan, when establishing the care team members and goals and action plans, and also to define the roles and responsibilities. They can also include when there have been significant change in the client's status that may impact the services and supports required. So some of these examples may include when a client is self-managing, they feel more independent, have more autonomy in terms of providing and taking care of themselves. When there have been significant change in health status, any sort of hospitalizations, and during discharge planning or client transitioning between sort of hospital sector to community, between community and long-term care, and other points as well. When new goals have been created and the care team members' roles need to evolve, or new care team members are added. And then lastly, during transitions in care. The next question is, who can I collaborate with? So collaboration can occur amongst the client, the care team members, the ICL, the client's primary care provider, and any family or friends that are considered a support to the client and for their goals. So just as a bit of a reminder, the care team members can be formal and informal providers or supports. So really think outside the box for this. So informal supports can include friends, neighbors, church members, or anyone else that is involved in the client's life outside of their healthcare professional life. There are multiple agencies within your community that already have had the HealthLinks model of care training and education that you are able to collaborate with. Ask the agency and really leverage that local expertise because, again, it makes things so much easier when you have that team to rely on based on their specific skill sets and expertise. In addition to this, the LHIN care coordinators and some allied health staff within the hospitals are also health links educated. The last question is, what is the role of the client's primary care provider? So the primary care provider can be a nurse practitioner, a physician assistant, family physician, or others that are considered primary care providers. We do highly encourage that the primary care provider to be involved as part of the care team and invited to be present in the care conference. The PCP plays a vital role in the client's health journey and can provide valuable information to the care conference. So this includes, but is not limited to, the client's health status, medical changes, and supporting the disease management stages. When engaging with the primary care provider, we ask that you consider faxing the standard primary care letter to bring awareness of the patient's needs for a coordinated care plan, or if that coordinated care plan has been initiated. So this can be found in the attachments that you have received. We do want to also bring attention to the billing codes. Physicians can bill for participating in the care conference. So this is also included as part of the primary care letter. Next includes inviting the PCP to be part of the care team. So you'll want to call the office to determine a time that would work for the primary care provider to participate in the care conference. Focus on their role as a patient's primary care provider. And you may want to ask yourself some of these questions. Are there immediate medical needs that have been identified? Is a physician signature required for the applications? Does the patient's goal or goals relate to disease management? Clearly communicate their role as part of the coordinated care plan, so this might change depending on the care team and the client's needs. Provide them with a teleconference or OTN option if they are unable to attend in person. Next, clearly communicate who their point of contact is, especially if they're unable to attend the care conference. This is essential so that they know who to contact regarding their patient's coordinated care plan. If they are unable to attend the care conference, you do want to offer to share the outcomes, establish a following-up discussion, if needed, and a revised copy of the coordinated care plan that you would then provide to them. Note that if the CCP is completed in Health Partner Gateway, it is viewable to primary care providers in Clinical Connect. You want to take the time to highlight this with the PCP, as it does ensure that they will have access to the most up-to-date version of the coordinated care plan, which can be downloaded into the patient's chart in their EMR, or their electronic medical record. So lastly, we'll just be going through some key takeaways from session number 4. A care conference maximizes collaboration and communication, coordination of services, establishes relationships, and provides an opportunity for the client's voice to be heard. A care conference benefits everyone involved. To assist in completing a care conference, it is encouraged to follow the HealthLinks Care Conference Facilitator Checklist. It is important that the client and care team members define their roles and responsibilities in regards to the client's goals, and the updated coordinated care plan is circulated following a care conference. A care conference can be conducted anytime throughout the client's journey. And lastly, conducting this care conference will naturally encourage collaboration amongst the client, care team members, and integrated care lead. So that concludes our session for today, and our next session, stay tuned for number 5.